Watch this video until the end. You'll learn which common routine test could dramatically raise your risk of stroke in just one night. This isn't fear-mongering, it's reality. And it's something most patients are never told. Subscribe now, because here we speak honestly. No sugarcoating, no panic, just the truth. Doctors often encourage regular testing. Fast and do a blood test. Check your cholesterol. Time for an ultrasound. Sounds like good medical care, right? But there's one diagnostic procedure millions of seniors undergo, unaware that it could be the trigger for a life-changing event, especially if you already have weakened blood vessels or a tired heart. What are we talking about? The stress test, a cardiac load test often used for heart screening. Treadmill tests, stress echocardiograms, pharmacological stimulation, all standard in preventive care. But if you're over 60, especially if you're not used to physical exertion, this kind of checkup can act like a detonator. Picture this. You show up for your test, push your heart during the exam, go home tired and dehydrated, lay down to rest, and then, during the night, a stroke. Yes, it happens. And it's documented in medical journals, but rarely discussed in doctors' offices. Why does this happen? As we age, our arteries become less elastic. Our blood thickens. Many seniors take medications that affect blood pressure and clotting, but not always in balanced doses. Add in the stress and physical strain of the test, and your heart starts racing, pumping harder than usual. The brain's vessels, often fragile and stiff with age, may not handle that sudden shift well. Now imagine this hitting at night, when the body naturally winds down. That's when silent strokes and full-blown cerebrovascular events occur. And here's the kicker. Patients are rarely told how to prepare for these tests properly. No one checks magnesium or potassium levels. No one asks how much water you drank, whether you slept well. Yet these tiny details can make or break the outcome. Dehydration, anxiety, and fatigue, combined with a stress test, is a perfect storm for a clot to form. One of my patients, a 67-year-old retired engineer, took a cardiac stress test just to be safe. 5 hours later, he complained of a headache. By hour 12, slurred speech and weakness on his left side, stroke. Why? Because no one warned him. If you have arterial stenosis, arrhythmia, or hypertension, such tests should never be done without proper preparation. What should you do instead? 1. Ask questions. Any test involving stress or stimulation should be approved by both a cardiologist and neurologist, especially after age 60. 2. Treat it like surgery. Hydrate well, monitor blood pressure, don't go in feeling tired or anxious. 3. Request alternatives. There are safer ways to check heart health: resting ECG, echocardiogram, or blood biomarkers like troponin. 4th, monitor yourself afterward. Even if the test seemed fine, avoid any additional stress for 24 hours. Watch for red flags like dizziness, weakness, confusion, or numbness. Remember, it's not the test that's dangerous. It's the lack of preparation and the failure of the system to treat seniors with the respect and clarity they deserve. You're not a child. You're not just old. You have the right to understand every test. And say no if you don't feel ready. You don't have to blindly agree to everything a doctor suggests. You have the right to ask, to question, and to protect your brain, especially when it comes to tests that stress the heart and put the brain at risk. If this video helped you, make sure to hit the like button. That way, YouTube will show it to others who may not realize how dangerous an ordinary test can be. And don't forget to subscribe for more honest, powerful, and life-saving content. No hype, no gimmicks. Just the truth that might protect you or someone you love. See you soon, and may your blood vessels stay clean and your mind stay sharp. Even after 70.